Hey there, this is Steve Lynch, LMT, licensed massage therapist at your service. And I'm chatting you up live from Limestone Therapeutic Massage here in beautiful Newark, Delaware. And the reason I'm chatting you up today is I want to talk about pain in the neck. Oh, I'm not talking about spouses or jobs or none of that stuff right there. We all know how that can be. No, I'm talking about serious physiological pain in the neck. Now, pain in the neck is bad by itself, and it can happen in a lot of different ways. We can have immediate pain in the neck. We take a fall, we can just feel that what we call a burner, just like and now you have this burning, numbing, tingling thing happening, and it's all kind of painful and crazy at the same time. And you can have some bad results from that long after that's worn off. We call that a burner, okay? But that's just one way that we can incur some what I call insidious pain that kind of creeps up later in life. All of these early childhood stunt kinds of pains in the neck that we incur from whipping our bodies around in certain ways, and certainly in car injuries, certain vehicle injuries. We call those acceleration, deceleration type of injuries, more formally known as whiplash, more commonly known. But we have a couple of different types. So we have a musculoskeletal system, and it has a couple of different parts to it. We're really more than that. But essentially, we're talking about soft tissue and hard tissue. Soft tissue, orthopedic, okay? Muscle, connective tissue, bone. And it is different. Although it's together, and both can cause pain, or one can cause the other pain, they're essentially treated differently. Okay, so this is how it's relative. So if we're talking about soft tissue, we're talking about tendon, we're talking about ligament, we're talking about muscle belly, we're talking about, connective fascia, and these things are what we call the soft tissue. When you injure soft tissue, it's a little different than when you injure a bone. Let's say the difference might be like this. They say, okay, it usually takes longer for soft tissue to heal than it does for bone. It can take 6 to 8 weeks for bone to heal, but a soft tissue injury may never heal, or it may take a long time, or months, or a couple of years, whatever case may be. So my point is that they will treat them differently. Okay, and there's a lot of different kinds of maladies that can happen. With soft tissue, you're more apt to find things like strains, sprains, tears, micro tears, and these kinds of things also produce scar tissue within that soft tissue formation. And that can be perpetually or can be insidiously painful down the road. Can have great effect on the way the bones of your neck are able to articulate, or how far around you can turn your head without shoulder or neck pain. Okay, and the orthopedic concerns are numerous and varied as well. Simple things, simple explanations or maladies might be an osteophyte, which is a loose bone fragment or cartilage fragment from prior injury that's kind of floating around in there. And it's really not problematic until you all of a sudden one day turn your head the wrong way, and bam, right there, bam, you got some pain, some immediate shooting pain. And then guess what? The pain doesn't go away, because what happened? The osteophyte lodged itself between the vertebrae in your neck and is now pressing on nerve roots. Okay, so that's one type of scenario. The other one might be bone spurs. Let's say you've had compression fracture or compression damage from jamming your head into a wall on a good party night, or whatever it might be. A compression type injury can damage the hyaline cartilage surface, or can damage that bone in between the vertebrae, and can also, as the bone tries to repair itself, not very good at making that slick, glassy hyaline cartilage that we need, like say on the condyles of our knees and stuff, really kind of make it slippery and floaty so that we can articulate right and slide right in the joint structure. Well, the body is really, it's decent at making bone, but it's not quite as good at making hyaline cartilage. Okay, so this is kind of how bone spurs occur, because the body tries to repair hyaline cartilage in between, joint structures like the vertebrae or the knees or the shoulders, but it can't do it. So what happens is it grows bone and bony bone and bone that goes in different directions, kind of like, those things, oh yeah, goat heads. You know those things, right? They get in your heel and they're just like, oh man, it's the most incredible pain. It's just like immediate, and you got to pull that sucker out. Well, bone spurs are kind of like that. And if they're in between the cervical vertebrae, now you got some pain, because that is some pain right there. Okay? And with soft tissue, it may be a little different. Okay? Orthopedic concerns, now you're talking about possible surgery, or probable, we'll say probable surgery, because osteophytes and bone spurs and things of that nature require more mechanical attention, more technical mechanical attention. But let's talk about soft tissue for a second, okay? Soft tissue has the ability to be repaired without scalpel and suture and staples and all of those kinds of things that we like to avoid, okay? And soft tissue can be repaired by technicians that use what? We use our hands, boss. That's what I was saying. We use our hands, and we can help soft tissue as clinical therapists or medical massage therapists or orthopedic massage therapists or neuromuscular massage therapists. Even your run-of-the-mill plain old massage therapist can do some good to soft tissue injuries to the cervical region, okay? And it really just takes going in there and getting your massage therapist to understand that you had some injuries and being spot on, being specific about where it hurts, because we're very well versed in anatomy and physiology and kinesiology, study of the movement of muscle in action. So having those skill sets, and I bet you didn't know your massage therapist had that kind of stuff, did you? But we do, and especially in the clinical or medical orthopedic kind of practice that we have here at Limestone Therapeutic Massage, where we care. So soft tissue injuries to the neck are not as permanent. They're not such a pain that you can't get rid of, unless there's some type of an orthopedic, a bone structure problem, such as an osteophyte, or maybe a bone spur, or degenerative disc disease, okay, which is a whole nother basket of worms. Then there's a good chance that if you come to us at Limestone Therapeutic Massage, or wherever you're at, if you seek out a good clinical or medical massage therapist, okay, they come in a lot of terms: clinical, medical, orthopedic, NMT, neuromuscular therapist, okay, and even your PTs, okay. So if you're having some pain in your neck, there's a good chance that, unless you've had some serious injuries, or unless you are having experiencing pathology such as osteoarthritis or rheumatoid arthritis or something like that, there's a good chance that the prior injuries of your life have exacerbated inflammation, scar tissue, adhesion in the soft tissue. And this is really what's causing pain during movement and restricting your movement ability in general. Okay, so if you want to go to your therapist and let them know, what kind of neck injuries you might have had during your life and where it hurts, we can help. So again, Steve Lynch, LMT, licensed massage therapist at your service here at Limestone Therapeutic Massage. Give us a call. See what we can do to help get that pain in your neck out of your neck and get you back into a positive game. All right, have a sweet life.